thank you everybody for joining us. I'm going to apologize in advance for coughing and clearing my throat a lot on this very smoky October morning. Thanks for getting together with us for this edition of DSA Virtual Access. Today, we're of course getting an update on chronic homelessness downtown. It's been a persistent issue for a long time. It's so complex in its origins, and it's tough on those experiencing homelessness, as well as everybody else. I can say with great confidence that everyone within the sound of my voice is eager to find sort of the next level practical solutions and to know the latest on some new initiatives. We have a terrific panel of experts with us this morning who know better than anybody what's required and what's now underway. Marvin Futrell is Director of Policy and Strategy for the Washington State Lived Experience Coalition. He's also co-director of the Housing Command Center, which we'll talk about in detail today. And he's a member of the King County Regional Homelessness Authority's Continuum of Care Board. Mary Frances Kenion is a technical assistance specialist with the U.S. Department of Housing and Urban Development's Disaster Response. Mary Frances is working with the KCRHA on coordination of the new HUD Housing Command Center, that's the HCC, you'll hear those initials a lot this morning, addressing homelessness in downtown Seattle. Before joining HUD, Mary spent nearly a decade working with homelessness and housing programs in the Washington, D.C. area. Sam Oppenheimer is Director of Policy and Operations for the KCRHA Systems Advocate Team, which provides outreach and on-the-street navigation to services and housing. Sam came to the KCRHA after working at the Downtown Emergency Services Center. And finally, Heidi Wiersma is Director of Special Projects for Partnership for Zero. She's been leading special projects for the KCRHA since January of this year. Before that, Heidi served for 3 years as Senior Project Manager for the Los Angeles Homeless Services Authority. Thank you to all our panelists. We'll get to you in just a moment. We always start out these sessions with some data points that we can look at, the most recent information we have to look at the situation in a very objective, concrete way. So here are some numbers. Overall, according to the King County Regional Homelessness Authority, or the KCRHA, which you'll hear those initials a lot this morning, 9,267 households experienced homelessness and received services as of July 31st of this year. Since August of this year, the KCRHA indicates their system advocates have connected with 665 people downtown in need of housing. Now, underscoring the dire circumstances, 86% of those contacted had been unsheltered for a year or longer. And as of May 2022, DSA and the KCRHA estimated there were 800 chronically homeless people in downtown Seattle. Now, given the different organizations and the initiatives and those initials and everything, I wanted to start off with a kind of a brief taxonomy of the different organizations and projects that are currently underway to address homelessness in downtown Seattle. We'll get to the HUD Housing Command Center, but I want to spend just a little bit of time refreshing people's memories or on some of the names that we're going to hear. Who wants to start off talking about the King County Homelessness Regional Authority, the KCHRA? Or did I said that backwards? KCRHA, isn't it? King County Regional Homelessness Authority. I'm glad we're doing this to set the record straight. Who wants to start off?
I'll start that off. Again, the King County Regional Homelessness Authority is a new organization. Our CEO started in April of 2021, but it's something that King County and the city of Seattle and area jurisdictions all came into agreement on, along with the Lived Experience Coalition. The stand-up of the agency was delayed a little bit with COVID, but we are here and we are cruising along. We sometimes call ourselves KCRHA, RHA, or the authority. If you hear that in any of the conversations, just to keep it interesting. Okay. And for clarity, even though King County is in our name, we are a separate entity from any of the other government jurisdictions.
Got it. And Project Zero?
Partnership for Zero, which initially I think was prior to my tenure at the RHA, was named Neighborhood Zero. Is an effort to end unsheltered homelessness and establish functional zero by focusing on specific geographic areas and scaling across the county.
Okay. And then the Lived Experience Coalition, Marvin Futrell. I'm not hearing Marvin's audio. Well, let's maybe we can address that issue. Somebody else want to take a whack at Lived Experience Coalition while Marvin sort out Marvin's audio issues? Yeah, let's maybe Marvin, you want to, I don't know, can Marvin log off and log on again and attempt a different connection or something? Let's move on while we can. Is any other panelists, can any of you address what the Lived Experience Coalition is while Marvin's offline? Mary Frances?
Yeah, sure. So
Okay.
one of the emerging best practices in this field, and many other fields, it's not specific to homelessness, is to really center the voices of those most impacted by the decisions and actions and program design and policy priorities, funding decisions that are made. So Marvin is actually working on behalf of the LEC as one of the several co-directors within the HCC, not to give you all alphabet soup, but Marvin brings not just grassroots advocacy and familiarity with the systems and how to navigate these different systems of care. They also have lived experience of homelessness, and that is really critical to the work that we are doing. I think historically, systems across the country have relied on people that go to school and get a degree and then enter this field without really including the people who understand the nuances of the systems. So this effort is unique in the sense that we were very intentional with the design to make sure that at the leadership table, we've got a nice blend of city, RHA, county, and LEC folks kind of at the helm of leadership so that there is more of a collective decision-making model with input from those who are most impacted and know the issues inside and out.
Okay. Well, I mean, the biggest developments, I think, in homelessness over the last year or two were obviously the pandemic and what that did to, force rapid response to some particular issues, addressing the issue in very different ways as had been in the past. And on the heels of that, the launch of the King County Regional Homelessness Authority. And then now this initiative, the HUD Housing Command Center. This seems like a big deal. It seems like a pretty radical shift or a big change that addresses a lot of the earlier issues around communications or allocation of resources and communications between different entities, all trying to achieve the same thing. Let's go to you again, Mary Frances. I mean, you're from HUD. You've seen this in other cities. What is the Housing Command Center, the HCC? What's the premise? What are you trying to do? And what's that look like in Seattle?
Thanks. That's a really great question. And simply put, what our team does is help communities respond to homelessness in the way that you would following a catastrophic national disaster. Usually with a disaster, you have a sense of urgency around helping rehouse people that have been impacted by the disaster. So we're just taking that framework and applying it to homelessness, which is very much a public health crisis, a housing crisis, a social justice matter. And the ways in which we do that, I like to call them 24-hour action cycles. We're bringing a group of experts. You all are the local experts in your community with, again, that blend of folks who have been most impacted by the system and have that lived experience. But we're bringing them to the table every day for about an hour to an hour and a half. And we are going through action cycles. We actually had our first public meeting yesterday where members of the public got to come and see how it's done. But we are kind of working through these different work groups that actually focus on one area. So we do have a comms team. You'll actually see behind me, that's our standing agenda. We have a housing acquisition team. There's a field operations team. And the goal of these 24-hour action cycles is to come up with solutions and bust barriers. And I hate to make it sound so simple, but it really is that simple. We are caucusing a group of folks that can make decisions and that can quickly pivot as needed with a goal of three things. It's how can we identify units? How do we acquire those units? And then how do we refine a move-in process that works at a pace that will allow us to rehouse as many people as possible. And Felix, before I pass it along, I just want to kind of highlight something that just came out in Bloomberg that I shared in the meeting yesterday around San Antonio and Bexar County in Texas. They just exceeded their goal of housing 1,500 people. And that was the spirit of the article. Last year around this time, they were at No People House. So that is pretty amazing when you are able to kind of transition from a scarcity mindset to an abundance mindset, particularly with the influx of both CARES Act and ARPA or ARPA funding. Oh, thank you for dropping that in, Emily. But like, we can do hard things, and we can systematize the way that we rehouse people to help the community, help our unhoused neighbors, and get people into homes, which is safer for it's safer for them, it's better for the community, it restores public spaces to their former glory, and it, you know, has a positive impact on future like health outcomes, both behavioral and physical.
Very good. Now, Heidi, you recently came to Seattle from after being in Los Angeles for a couple of years and working on this issue. So I think you've been here since January. What does this mean for this creation of the HCC, the Housing Command Center? What's the immediate reality in terms of how your work has shifted and what this means for what people are trying to get accomplished here in Seattle and King County?
Yeah. First and foremost, I think the thing that's most exciting is that we're oriented towards permanent housing. We're taking people who are currently living unsheltered and pairing them with a peer system advocate and streamlining the process so that they can move into permanent housing. My previous work was really focused on moving people into shelter, and that it got tiring. I wanted to go straight to the source, and the thing that makes the most impact on people is permanent housing. And it's been great. And what I feel like is awesome here is that we have the support of a lot of different partners, DSA, the Chamber, philanthropy. You know, it's really a community effort who's invested in breaking the barriers, as Mary Frances said.
And it seems like part of the barriers is the communications issue with the general public. This notion of winning hearts and minds for an issue that's often felt intractable, often felt like it was getting worse, or is sort of, you know, hard for people to measure other than what they see, you know, walking through downtown or driving through downtown or spending every day in downtown. Is there an aspect of this, because Mary Frances, you're talking about this using this disaster relief model. And when there's a hurricane or an earthquake or a tornado, everyone gets that something terrible happened and that these people who were, you know, made homeless need to be rehoused. How do you communicate that urgency when the issue has been in place for a long time? There hasn't been a hurricane or tornado. Obviously, there's been a pandemic. But how do you keep the general public and people who only pay attention every so often as to what's going on, feeling like there is progress being made and engaging with the public to help them understand your work and support your work?
Thank you. That's a great question. And I think we've taken a number of steps, including what I just mentioned previously around permitting the members of the public to come into the space and see exactly how operations are unfolding, but also so that they have an opportunity to see this group of stakeholders, both government, nonprofit partners, citizens, LEC, and everyone in between, engage in a very transparent way. Seattle, King County, not unique in terms of the volume of folks experiencing homelessness, particularly unsheltered homelessness. A lot of communities are grappling with this throughout the country. So the reason why we make the meetings available to the public once per week is so that we can restore some trust, so that we can build on the sense of urgency. Homelessness anywhere is definitely a community issue. It impacts businesses. It impacts the folks that are actually experiencing homelessness, providers. So our goal is to reestablish some trust and share often successes, but also failures, because we encounter them every day in our meeting. And guess what? We have to be flexible and agile enough to pivot and come up with a plan B, a plan C, and sometimes a plan D. Lastly, I'll just close with this. We did have, I think there was a press conference last week. I was not here on the ground, but that wasn't an effort to make sure that we're communicating exactly what's going on, because just as much as we are around this table committed to actualizing this work and showing folks that we can rehouse a high volume of people similar to other cities. We just recognize that there might be some level of skepticism, and y'all need some proof in the pudding, so to speak. And that's exactly what we're working towards. So that transparency is going to continue. Again, every Wednesday there's a sign-up process for members of the public to come and join us, and we'll continue to share our successes and even failures or roadblocks.
Okay, and we're getting some good questions in the Q&A box, which I'll get to in a second. And but I wanted to ask Sam Oppenheimer, in terms of the implementation of people working on this actual outreach and daily coordination, does the Housing Command Center affect your work directly, or is it sort of just is it a function of a mosaic of services, or what's the big shift for what you're seeing?
Yes. Hi, everyone. That's an excellent question. And so it's one of the things that's really deeply exciting for me about the Housing Command Center, especially having worked in the field for the last 8 years here in Seattle and over a decade, across the nation, is it's taking what has felt like a very fragmented, difficult to navigate system for the people who have to go through it, and as someone who's also operated within it, and synthesizes everything that we need to do in one place so that we can do the barrier busting, as Mary Frances mentioned, and so that folks with lived experience, Marvin included, myself included, as well as everyone who's a member of my team, the System Advocates workforce, we're able to influence and make decisions together around what our plan for operations is going to look like to address these issues on a systemic level. We're able to collaborate across multiple teams. And so my team is one of the group that's called the field team. And we are bringing in providers across the region, all who operate and provide direct services to folks who are living outdoors or unsheltered neighbors. And so there's coordination happening daily at a rate that is truly just unprecedented in our community. And being able to operate up on that 24-hour cycle means that we don't get stuck in trying to solve yesterday's problems with old information. We are always able to address everything with this immediacy and sense of urgency that we truly need to have, and that we see in disaster responses in order to shift how we are responding as a community. And so it's deeply exciting for me and for our team to be able to be a part of. And we are already seeing, a visible difference even in just the length of time that it takes from when we first engage with an unsheltered neighbor outdoors to when we're able to make that housing match.
Got it. Now, Marvin, is your audio, can we hear you now, Marvin? Is your audio working? I don't think it's working yet. There's a question from one of the audience members. I'll paraphrase it a little bit. And then we talked about this in our preliminary meeting as well, this notion of the post-disaster relief model addressing housing for people who've been, their houses have been damaged from a natural disaster or something. Where does the behavioral health, substance abuse, how does that fit into this? Because obviously in a hurricane or a tornado or an earthquake, it's not, I'm sure some people obviously who suffer in those kinds of disasters are experiencing that, but with homelessness, those issues are prevalent so many times. Where does addressing that part of the problem fit into what the Housing Command Center is doing? Who wants to take that?
Yeah,
Mary Frances?
Kind of
okay.
Yeah, sure. I can kick us off on that.
Okay.
So we, HUD is providing the technical assistance for this effort. And we do adhere to housing first principles. And that just means that we focus on housing first, and then we start to focus on the other aspects, whether it's behavioral health, whether it's physical health, whether it's, access to income, employment opportunities. All of those are considered supportive services and wraparound services. And in that instance, I see the question is asking about fentanyl addiction, and what I would kind of pivot to is that, yes, we're focusing on housing first, but not housing only. And the systems advocates, for example, I had an opportunity to catch a 5 a.m. outreach shift with them a couple of weeks ago, they do offer harm reduction kits. That is one of the features of the Systems Advocate to help folks that are in active addiction.
Okay.
And I would also just note this, Felix, before I pass it over to Sam. When you think about addiction, there are millions of people who are addicted and remain employed and housed.
Yeah.
That is just a fact, and they get to be in housing. And housing is an opportunity for those who have been unhoused for longer periods of time to really focus on long-term recovery. It's really hard to get treatment or go to a 12-step meeting when you don't have a safe place to call home.
Yeah. And Sam, you're going to add something?
Yes, absolutely. And so, especially from the system advocate's perspective, but also as a behavioral healthcare provider myself, something that we need to do not only as the direct service arm of the RHA, but as a system is have a holistic wraparound approach to care for folks who have been traumatized by their experience of living outdoors without shelter, with being subject to the elements. As Mary Frances mentioned, addiction is an issue for both our unhoused and our housed neighbors. And it is so difficult, sometimes near impossible, to take those steps towards recovery when folks don't have just the fundamental safety of being able to close a door and say, like, I am in control of who is in my immediate environment. We know that, over 90% of people experiencing homelessness have long histories of trauma, and histories of trauma also impact the ways in which people are able to cope and inform, how people use, whether you're housed or unhoused. And so this is where we see that housing is a part of healthcare. And when folks have that and we're able to do that quickly, that's also when we can start working on the other parts of folks' recovery journey. And so if someone is interested in support with decreasing their use, with engaging in other strategies, with pursuing recovery, whether that be detox, whether that be inpatient treatment, whether it be long-term outpatient care, all of those things are easier to do when folks have the stability that comes with having a safe place to live, where your environment is predictable.
Yeah,
and then with the system advocates and how we tie into the work, we work with folks from when we first meet them on the street, and we walk with them not only to the door, but through the door of housing. And then we stay with people for at minimum a year of that transition inside to be sure that we are continuing to provide support to walk alongside folks on that journey.
Yeah. Now, another question from the Q&A box. Again, if you have this audience, please feel free to drop in those questions. This is about this notion of the HCC, or the Housing Command Center approach, being used in other cities. And if there's lessons that are learned, because the issue is it's not exactly the same in every community. That climate makes a difference, political climate, actual climate. But in the other cities where it's been, first of all, Mary Frances, if you can tell us where this approach has been tried, and did it work really well everywhere? Were there issues and lessons learned from those other cities?
I am not going to lie to you. We have done some work in some cities that shall remain unnamed that weren't as successful as they could have been, because the perhaps political will or local leadership or stakeholders were not able to come to the table in a way that would support this level of work or this depth of work, because it is very intense. And it has worked in a number of communities, communities like Houston, Texas, which had a great feature article in the New York Times a few months ago. Communities like the city of Atlanta, communities like Indianapolis. We've even done some pretty positive work, and I know Los Angeles gets a lot of heat in the news down there, but they've done some pretty incredible work with demobilizing some of their non-congregate shelters that were set up through this approach. So I think, just as you mentioned, Felix, the conditions have to be right for this model to work. There has to be a commitment from all levels of leadership. There has to be political will. There has to be a willingness to commit sufficient resources to actualize the work. And there just has to be folks that have the capacity to come to the table and to carry on the work throughout these 24-hour action cycles.
And I guess one question that makes me think about is this notion of sort of the cynicism, because there are definitely people in Seattle who look around and think, oh, it's worse than it was a year ago. This isn't getting any better. There's hundreds of $1 million being spent here, and this isn't any different. It's worse. So, what are all these different organizations doing? And let's hear from we'll hear from the local people first. Not you, Mary. No offense, Mary Frances. It's great that you're here with the federal government. We appreciate having the resources here, and hope you can stick around. But what would you say to somebody who's either a business owner, maybe they're a commuter, maybe they go to Seattle occasionally for entertainment purposes? How do you bring those people back if they're feeling cynical, if they're feeling like this is just yet another same approach with a different name and a slightly different cast of characters? Help talk a cynical person out of that belief. Who wants to start? Heidi, you want to take a whack at that?
Yeah, I can start. And I think the most important thing is to be honest and acknowledge that we've had previous plans to end homelessness that weren't fully implemented and not followed through on. And any one of the previous plans could have made a difference if it had been fully implemented. I think the thing that we have to remember is that there's no silver bullet and there's no magic switch that we can flip to solve homelessness. There are no heroes, there are no villains in this work. There's just a lot of work that we need to do. And there's a renewed commitment. We have a new organization, a regional homelessness authority that is able to coordinate, and we're just gonna do our best.
Sam, do you have something to add to that?
Yeah, and I'm glad you brought this up, because it's not only like business owners and people visiting who are skeptical of efforts, it's also our unhoused neighbors outdoors who are skeptical because they've been burned by systems that haven't been able to fully deliver on the promises that they've made. And so there's an element here as well of us, truly, and I don't mean this in a precious way, I'm being sincere, like we need to be able to under promise and then vastly over deliver on what it is we are here to do. And what we mean by that, put very simply, is we are going to swiftly connect people to permanent housing at a rate that is unprecedented and a scale that is unprecedented. Part of the approach that we are taking is operating with a laser targeted focus downtown so that we can demonstrate that proof of concept to the community. The proof is in the pudding. Like when people see the difference over time, and we are just getting started. And so there's a lot that we're going to be proving. And we can do it here. And then we're able to scale it up. Like that is what I think is going to win over folks, because at the end of the day, what people want to see and what they want to hear are results. And we are taking a very data-driven approach to that as well, where we are able to track daily, because we have these daily meetings, how many people have we engaged? How many folks have we connected to housing? How many people have applications pending? What are the barriers that we're running into? And be able to transparently report that out.
Okay. Now, is Marvin's audio? Marvin, are you available? Are you able to hear us? And can we talk to you? My screen's freezing again. Just personally, I think there's huge opportunity for storytelling and kind of not in a disingenuous way, shaping the narrative about the success stories and why what's being done is being done, how it's different, how there's progress is being made. And the dashboards that cropped up during the pandemic, I think I've said this in previous sessions, I thought those were remarkable, how much data they packed into a single screen where you could kind of take a pulse of what was actually going on with some of the most key statistics during the roughest part of the pandemic. I think that those hearts and minds, which I've also mentioned before, I think are ripe for really good storytelling and really good, not quite inspirational, but just ways to connect people with the narrative so they know that progress is being made and that there is a different approach. I know you mentioned this, I think, Mary Frances, that part of it is just dealing with roadblocks, just breaking down barriers that are in the way of progress. What are those big roadblocks? I mean, obviously more money is always appreciated, But are there other political realities? What are the things, if you had a magic wand, you wish you could just wave over and would go away, that would make this work easier than it is, or go faster than it might take, given the realities of 2022 in Seattle?
That's a really great question and framing, and I'm trying to think of some of the barriers that have come up. I mean, identifying fiscal agents to help with components of the work, identifying available units is a challenge, because oftentimes there are units that are available that aren't necessarily desirable or safe for folks. So one of the strategies that we have to overcome is finding units that are vacant units that have landlords who are willing to partner in rehousing unhoused neighbors and maybe reducing some of their typical tenancy screening criteria. It's also making sure that we identify units that are more desirable. And what I mean by more desirable is that they're not situated in a food desert where there's no access to healthy food or grocery stores or supermarkets. Making sure that they're near transportation lines, making sure that we're not identifying units that would otherwise cluster folks in one specific area of the city over another, and finding units that fall below fair market rent, which is challenging, but we have identified over 300 units. And the ways in which we've done that is just by having one of our colleagues who's a TA provider do a regular scan of the available stock. And we found these units pretty quickly. We are working on starting to build a portfolio. So I'm going to insert a shameless plug here. If there are any landlords on the line who are interested in partnering and moving our unhoused neighbors into housed neighbors, please, please, please reach out to us. We do have some incentives that we can offer for this partnership, but we'd love to partner with you. That's going to be one of the biggest roadblocks that we face, is offering our unhoused neighbors a home of their choosing that meets their needs, which might mean that they need to bring a pet with them indoors. So we are looking to provide units for folks that they actually want to make home and will take pride in. We are not interested in units that don't feel safe to a participant or are in a part of town that they are connected to their community. So that's my shameless plug, and I'd love to hear from Sam and other folks about barriers as well.
Yeah, and let me refine that question a little bit in terms of the barriers. Given that the King County Regional Homelessness Authority is a separate entity, are the other entities that are most directly involved, City of Seattle, King County, State of Washington, federal government, are they doing as much as they could be doing, should be doing? Are they, is the KCRHA getting enough support from each of those levels of government, or who wants to answer that?
Can I start with that? Just from a HUD TA perspective, and
Sure.
Having worked with a lot of public housing authorities throughout
Sure.
the country, the Seattle Housing Authority and King County Housing Authority, y'all have two treasures in this jurisdiction, and they are both it. They've been very gracious and supportive and actually participating in the work. Don't know if folks are aware of this, but they are one or two of the housing authorities throughout the country that have done an amazing job with getting vouchers out of the door that were specifically appropriated for folks experiencing homelessness. And I just wanted to name that for everyone. That's been my experience.
And I'm happy to say that we've had great support from our state, federal, and local partners. We can always use more, but we are really pleased with the way that folks have been showing up to the table, interested in how they can help. And the biggest barrier that I think we're doing a great job of working through is streamlining a very complicated process, a lot of processes and a lot of systems. If you've ever had to navigate, the health insurance field and getting a referral from a specialist, is it in network, is it out of network? I feel like that's a similar experience. And so thankful to our federal partners who are saying like, hey, this isn't a must-have thing. Like, let's think about how we can streamline it. And then the other thing that's really different and unique to this is the addition of our system advocates who are peers and, like Sam said, are really working through, are working side by side with folks, not just into housing, but to remain housed. And then the other thing is the incorporation of people with lived experience. You know, when you design something, it's really important that you understand the people that you're designing for and working with, and we're doing that here.
Okay. And Sam?
Yeah, I would 100% agree with what Heidi and Mary Frances mentioned. We have seen record investment from our city and state partners, especially from the pandemic and with this recent effort with the HCC. And we want to sustain that over time, especially as we want to be able to grow and scale up what we are doing here. We know that we are just getting started. And as you mentioned, you know, at the beginning of our session, there's, you know, at least 9,000 people that we want to be able to reach as we grow. And so that means we need to scale up the resources available as well so we can meet the need.
Okay. And one of the initiatives, or I don't know if it's a recent project, is this sort of the by name list, which is I think I thought that understood that as a relatively new approach, at least here in Seattle, King County. What is the by name list and how is that changing things as compared to the more recent past? Is that a question for you, Heidi?
That's a question for Sam.
Okay. Oh, sorry.
Yes.
Go ahead. All
That's
right.
okay. I can get us started. Thank you, Heidi.
Okay.
Thank you, Felix. And so to put it very simply, a by name list is a tool that allows us to better know and understand the specific needs of all of our unhoused neighbors. And so it is a living database that is representative of every single person who is experiencing homelessness within our defined community. And so we are able to know exactly how many people are living unsheltered outdoors. So we have the scope of the problem and we're identifying our starting point because that is how we are going to measure success. In addition to that, there's a human and relational element to this as well, where we are getting information around what do folks need to resolve their homelessness? What kind of housing intervention is going to be most appropriate for you? What's going to be safe for folks? What are their healthcare needs? I know there's been many questions in the chat about healthcare, about overdose, about behavioral health supports. We include those information as well because this ties to success in maintaining housing. And we can do a better job at case planning, at service matching, and with housing placement. And with the by name list, we generate that with not only through the system advocates and their engagement efforts throughout the community. As of this morning, we've already engaged 726 people living outside, so we've been higher than that number we initially reported. And we have partners with PDA, with REACH, with Seattle Indian Health Board, with all of the community providers who are also providing outreach and engagement services downtown to be sure that we are not missing anyone in that effort either. And so this is really exciting because we can use this database and list to measure success over time and make sure that we are incorporating a holistic approach to matching folks to housing that will truly fit their needs.
And this has been touched on a little bit, this notion of trust and this notion of unhoused people who felt burned by previous attempts or previous efforts to, you know, help them get off the street. This notion of trust and the notion of, it comes up a lot in media reports too about when, you know, a particular encampment is dismantled and, you know, X percentage of the people said no to, you know, being housed someplace and moved on to, you know, to another camp someplace else. What's it going to take to address that aspect of the lack of trust or the ability to build trust with people who have so far been, you know, turned down this kind of help? Sam?
Marvin would like to take that.
Oh, perfect. Is he there? Oh, I'd love to talk to Marvin. Is he?
Even though I'm probably still not on the screen, I'd like to address that. Trust and working in the community with systematic approaches to house individuals has not been the greatest relationship, sometimes to the scarcity of resources that are available versus scaling towards what the need truly is. I'm gonna jump back to the by names list. Getting an accurate list of folks that are unhoused in our community is essential to being able to understand what the needs are for housing acquisition options so that they can be paired and matched. For our unhoused population has grown steadily over the last 25 years. It has been through several iterations of a 10-year plan to end it, 5-year plan to end it, but incorporating that experience into how we develop policies and programs is going to be essential to rebuilding the trust that what we're doing, what is being done to house our neighbors is being built on their voices and their voices and experience and system expertise working hand in hand to make sure that that occurs.
Okay.
So the trust is being part of a bigger conversation. We reach out to our house communities often. We try to always include them. Our unhoused neighbors are now part of that greater discussion. And so the trust that everything that can be done is being done gets a little easier.
Is this our last chance to really fix this problem? You're having federal government assistance through Mary Frances's presence here and this new initiative with the Housing Command Center. Is this, I mean, given what you've said about trust, given what we said about some other initiatives that weren't fully implemented either for financial or political or other reasons, is this, I mean, do we all have to get behind this if this is really going to be addressed, not for once and for all, because I get it's an ongoing issue. It doesn't just get sewn up and put away. This requires a long-term, far horizon viewpoint, obviously, but this seems like it's a pretty big deal. Seems like this is like, here we are. Am I being too dramatic?
Here we are.
But we also,
It's everyone coming together to address the issue. It's not asking some individual or one agency to fix the problem. It's bringing everyone into the same room, at the same tables, from design, implementation, and evaluation of what's being done. Because the single goal is to house our unhoused neighbors in our community.
And you guys are meeting, is it 7 days a week? Is it 5 days a week at the Housing Command Center?
5.
And that's, and that's great. That's like that kind of disaster style relief and disaster style response to a emergency is exactly what's needed. But and I always keep coming back to this hearts and minds question, this communications question, because it's, I work in media and I like storytelling because storytelling gets people to understand, tugs at their hearts, tugs at their emotions, but then gives them the data, then instructs them what they need to do to be part of the solution and not the solution. So how do you get this Housing Command Center mentality, hearing an echo there, Housing Command Center mentality for beyond just that room down at the Emergency Operations Center in Seattle? How do we get the person who is, disappointed or cynical or sad several times a week when they're driving past a tent encampment or, having to confront somebody who's, blocking their path to the bus stop or whatever? How do you get this? How do you orchestrate that people caring and understanding and knowing what's going on and knowing that something's being done, feeling like their tax dollars are being used wisely, feeling like their business or their home is worth maintaining in downtown Seattle? I mean, it's a big question, but how do we get people motivated and engaged constantly, not just when there's a problem or not just, at a panel discussion on a Thursday morning in October?
Just to elevate what Sam said, we have to let the results speak for themselves. And it's really important that we work with partners like DSA and the Chamber to tell the story. And we're working on that. We're about at the 45-day mark of meeting in the Housing Command Center. And we've been working since day one to figure out what is our messaging? How can we communicate in a way that's relevant to the public and to our other stakeholders? And you'll be seeing those things roll out in the near future. And we will continue to communicate our progress to folks.
Okay. Now, Marvin, I'm glad you're back with us, and I'm glad we can hear you. I'm not sure how much of the earlier conversation you heard, but I wanted to give you a chance to talk about the Lived Experience Coalition.
How do I speak, guys?
I can hear you. I can hear you.
There we go.
Kind of define what that
long journey.
Yeah.
Thus, I'll offer it's the long journey for folks who have experienced being unhoused, being asked to be part of the creating the solutions. We stand on, I seem to have an echo, but we stand on the shoulders of folks that have worked for a long time over this issue, both in system and those in our communities. The Washington State LEC grew out of a community of people that met often in the downtown area for years to advocate, to be part of the decision-making process and the designing process of several efforts to undo homelessness. They led in the formation of the KCRHA. They took direct involvement in creating the RAFT. I think that stands for regional. I've struggled much this morning in getting started, but I may have lost my groove. But the difference here is things are not being done for people. Our community is coming together as neighbors to solve an issue that affects some members of our neighborhoods, so that we're always working in community. That has been the work of the Washington State LEC for the last 4 or 5 years, from advocating and to actually being present in the rooms that are addressing this issue. That includes the KCRHA, that includes the Housing Command Center. And it shouldn't be thought of as new, but something that has long been needed. What's new are going to be what the outcomes are. And we'll get to evaluate those, and we'll get to modify and work with things as this progresses, as we house more and more people. So.
Okay. One of the questions from one of the audience members is this notion of the most prevalent myths about homelessness in downtown. And I imagine those myths oftentimes can get in the way of getting real work done. Are there a couple of prevalent myths that would be worth addressing here in terms of setting the record straight about the issue, the individuals, the status?
Okay, so I'd like to start with the biggest myth is homelessness is what we see. That's a myth. As we work together in community and we meet our neighbors, we find that a large community of people are unhoused. They're not the same. Their needs differ widely. Our response systems need to differ widely to meet the community. If I often have shared with my partners at the KCRHA, the folks you see may be 10 or 15% of the number of people unhoused in our neighborhood. So I offer that that's one myth we need to do away with and work with our unhoused neighbors holistically and address everyone's needs, not just those we visibly see and are easy to connect with, but the community as a whole and developing different ways of making sure that we are bringing those numbers into bear so that what we do actually meets the need.
Got it.
Time is always against us on this.
Got it.
I think one more myth is that people who are currently living unsheltered don't want to move into permanent housing. And something that's really central to the work that we're doing here is centering personal choice. Change is really hard. And when I moved here from Los Angeles, I had choice over what neighborhood I lived in so that I could be close to work and close to people who are important to me. And in this effort, we are centering those and other choices for the people that we're serving.
Good. Sam?
Yeah, I want to build on what Heidi and Marvin mentioned, because when our team is out there in the community and we've been engaging with folks to build our by name list of everyone who's experiencing unsheltered homelessness downtown, people flag us down when we are on the street. They bring their friends with them. There was an event, I know Mary Frances was there for part of it, where we were at Westlake Park starting at 4 a.m. and there were no one on our team realized how many folks were down there at that time of day, because you don't see it during the rest of the day. And so speaking to what Marvin mentioned, like people have to do things in order to survive and try to keep a low profile so that they can be safe in the community when they're unsheltered. And so we have to be really creative in how we meet their needs, and offer real choices. Like Heidi said, if we're coming to someone with only shelter, which isn't permanent housing, and that shelter comes with rules where I have to be in by a certain time of day, where, like, if I can say this as a sexual assault survivor, if I have to be in a setting where I am in a room with a lot of people I don't know, and it's dorm style and folks are close to me, we're in a congregate setting, like that's not going to feel safe for me, and that doesn't feel safe for lots of folks. And that's why some people opt to be outside, because that is a space where they feel like they're more in control. And when we go to folks and we're engaging with them on the by name list and saying, like, we're here to help you with housing, and we're able to say, this is what every step of that process to match to housing is going to look like. We see and hear that folks are excited. We have folks say, like, when am I going to see you again? Like, when can I connect with you? There was an event yesterday where we were downtown, and someone we had engaged with the day before brought 10 of their friends and said, like, they were really skeptical, but I told them what you were doing and they want to meet with you too so that we can get on the list. And part of why our unsheltered neighbors, like folks who have been burned by the system before, as we mentioned, over 86% of folks that we've engaged have experienced homelessness for over a year. We've met some folks who are saying it's been 25 years, 30 years. Some people who, have grown up in the foster care system and tell us, I've never had housing. I've never had a home of my own in my entire adult life. And we're already matching folks to housing in the short time that we've been activated to encampments. We have people with housing applications pending. We have move-in date set for the end of this month, and people hear that and they see that in the community. That is what generates the excitement and the momentum for us to be able to move forward.
And we have time for just one last question, then we'll do a kind of a round around the horn with each of the panelists as we get toward the end here, which we're about 4 minutes away from 10 o'clock. Now, in addition to HUD providing this level of oversight and kind of helping bring people together, did this initiative unlock any more, any additional resources, or there are new facilities coming online, or new things that weren't there before? Or is it, and it's not merely, was this more of an orchestration of things that were already in place, or are there more resources come along with this initiative? Anybody? Mary Frances?
That's me.
Sorry.
Sorry, we're meeting the HCC meets at 10 a.m. and I'm just coordinating entrance to the building right now. But I am also present. One of the new resources that we're unlocking is, as Mary Frances mentioned previously, creating a housing pool of private housing. In the past, case managers have been asked to do the job of folks who work in real estate, which is to communicate with landlords and convince them why they should rent to someone who doesn't have a rental history and may have some other barriers. And so we're engaging with HUD technical assistance team and folks with property management background to create a pool of units and landlords that folks can move into. And then the other thing that we're working on is maximizing the resources that we have. As I mentioned previously, the process of moving into permanent housing for someone who hasn't maybe been in housing for a while can be really complicated. And so we're working on streamlining that process and bringing all the relevant folks to the table so that we can do that in a way that's as seamless as possible. And again, the other two important things are that we are working with folks with lived experience, and that we're also pairing people who are moving into permanent housing with a peer that's a system advocate.
Oh, wow. Okay. Now, there's lots of interest. There's lots of questions we didn't get to in the Q&A, and lots of interest in how to connect with these Wednesday meetings and that sort of thing. Can someone give me the succinct version of how best to connect with the Housing Command Center and how to help out if people want to get involved? What's the best way? Who wants to take that? Just a quick, like, is there a website? Where should people go?
There's a link that you can sign up if you want to attend the meetings. And I saw in the Q&A that perhaps the one that's currently up is broken. We have our communications team listening into this call, and they will follow up with the DSA to make sure that that link gets out to the folks who've attended today and are interested in signing up.
All right. Well, very quickly, I want to give each of you 10 seconds. Give me something to be hopeful about, some reason to be hopeful about the future for this issue in Seattle and King County. And I'm going to have to hold you to 10 seconds, given how close we are to 10 o'clock. Why don't you go first, Marvin? Time's up. No, just kidding.
Okay.
No, I'm just kidding.
I'm hopeful that what we've started here, that bringing the voices of lived experience into the work that we do and what is crafted, is not a one-off. It is something that we do now here, and it's part of the other communities' work as we show the power of folks working together in community.
All right.
Thanks.
We are pretty much out of time, but I'm gonna say, Marvin, give you the last word, Marvin, because we are just about out of time. I want to thank our panelists, Marvin Futrell, Mary Frances Kenion, Sam Oppenheimer, and Heidi Wiersma. Thank everyone who joined in for DSA's Virtual Access program. Thanks to DSA staff, John Scholes, Sally Wright, James Cito, Emily Baylor, and Ryan Gokul. Please plan on joining us again on November 17th for our next episode of DSA Virtual Access. Keep an eye in your inbox for more information, or you can get more details at downtownseattle.org. Until then, I'm Felix Bonnell on behalf of DSA, and thanks for joining us this morning, and we will see you downtown.